Everyone, I'm Dr. Shin Young Yim. Today, I am going to tell you about the symptoms and causes of cervical dystonia. What is cervical dystonia? Cervical dystonia is also called spasmodic torticollis. Cervical dystonia, a painful condition in which the neck muscles contract involuntarily, causing the head to twist or turn to one side. Cervical dystonia can also cause your head to uncontrollably tilt forward or backward. Let's look at the symptoms and signs of cervical dystonia. The involuntary muscle contractions in cervical dystonia can cause the head to twist in a variety of directions. This patient shows the chin toward right shoulder, and right ear toward right shoulder. Therefore, he has right torticollis and right latericollis. This patient has the chin toward left shoulder, and right ear toward right shoulder, showing left torticollis and right latericollis. This patient also shows dystonia on her right arm, along with left torticollis and right latericollis. Cervical dystonia also can be generalized, focal, multifocal, or segmental. The involuntary muscle contractions in cervical dystonia can cause abnormal posture of the head and neck in a variety of directions. In some cases, the involuntary muscle contractions associated with cervical dystonia can spread to nearby areas of the body. The most common locations include the face, jaw, arms, and trunk. Many people who have cervical dystonia also experience neck pain that can radiate into the shoulders. The disorder can also cause headaches. A jerking motion of the head, called head tremor, also may occur. Many people experience difficulties in activities of daily living and might avoid interpersonal relationships. The symptoms of cervical dystonia can be exhausting and disabling. Some people experience sensory trick that sensory stimulation such as touching the neck or shoulder can ameliorate cervical dystonia. Some patients often discover some improvement early in the morning, called morning benefits. Many patients experience that stress or excitement may aggravate symptoms of cervical dystonia. The symptoms usually begin gradually. They may get worse over time and then reach a plateau where they don't get substantially worse. Within about 1 year after onset, about 10% to 20% of patients recover. Cervical dystonia is a rare disorder with the prevalence of 5 to 20 per 100,000 people. Although it can occur at any age, cervical dystonia most often occurs in middle-aged people. The male-to-female ratio is from 1 to 1.4 to 1 to 2.2, which is relatively common in women. 70 to 90% of cases are in their 30s and 50s. Let's talk about the cause of cervical dystonia. Cervical dystonia occurs due to functional abnormalities in brain regions such as the midbrain or basal ganglia. Most people with cervical dystonia are called idiopathic, where the cause is unknown. Some cervical dystonia is caused by medication that blocks dopamine, such as some antipsychotics. Some people have a family history of the disorder. Researchers have found gene mutations associated with cervical dystonia in some cases. Cervical dystonia is also sometimes linked to the injuries or diseases of the head and neck. However, not all these risk factors result in cervical dystonia. A person who has a genetic predisposition of cervical dystonia can develop cervical dystonia when the risk factors are given such as infection, trauma, certain medications, and stress. There are a blue person and a pink person. The pink person has low genetic predisposition to cervical dystonia. In this case, even if the risk factors are given, cervical dystonia does not occur. However, the blue person already has a high genetic predisposition to develop cervical dystonia. When a risk factor is added to the blue person, cervical dystonia can develop. Today, I talked about the symptoms, signs, and causes of cervical dystonia. Thank you for watching this video. I am going to tell you about the treatment of cervical dystonia in the next videos. See you next time.